So hi guys, welcome. Today let's look at classification and treatment of seizures. So seizures are classified as partial and generalized. And partial seizures include simple partial seizures, which come by motor, sensory, and sensory motor consciousness is not impaired. So complex partial seizures starts with an aura. So later impairment of consciousness happens and often accompanied by automatic behavior. So partial seizures are becoming more progressive to generalized, and under generalized we have absent seizures, tonic seizures, myoclonic seizures, tonic-clonic seizures, clonic seizures, and autonomic seizures. So what are the clinical features? So meticulous history from patient and reliable witnesses in critical is very critical in diagnosing a seizure disorder. So asking about the prodromal phase, aura phase, and the type, the duration, and the frequency, and also the age and onset of the seizures. So also details about the post-ictal phase is also very important. So you're also supposed to ask about precipitating factors such as alcohol. Alcohol is usually a big factor. So when a patient presents with this, what investigations are you supposed to do? So first of all, you have to do thorough physical examination, including a fundoscopy in newly diagnosed cases. We're also supposed to do a skull X-ray so as to rule all cases of possible radioalkant facial lesions, raised intracranial pressure also. We also have to do a full hemogram. We also have to do a malaria parasite, especially in children, blood sugar, urea, electrolyte in cases where metabolic conditions are considered as a cause of a seizure disorder. So we also have to do an electroencephalogram. We also have to do a CT scan, an MRI. First of all, straight up, let's go to the management of such a condition. When a patient presents with seizures, how are we supposed to handle? First of all, first aid is very important. So during an epileptic attack, you're supposed to place the patient in a left lateral position with the head turning the same side. Also, you're supposed to remove or loosen tight fitting clothing that are around the neck. You remove dentures that are inside the mouth. So also you do not apply or insert any instruments into the mouth so as to avoid tongue biting because it may have already occurred. Also, you're not supposed to put the patient in a condition whereby the people are crowded around the patient, so as to ease and facilitate more oxygen circulation. Also, allow seizures to complete because it's caused without physical attempting to hold down the patient. So, however, remove patients from danger such as fire. So also after an attack, investigate the patient as outlined previously. We were talking about how is the patient presenting. That's how you get to classify the patient. What is the general management of this condition? First of all, you have to treat underlying diagnosed condition if possible, such as hypoglycemia and meningitis. Also, establish a firm diagnosis before starting therapy. For most patients, you also have to start therapy at outpatient level so that they can have close monitoring of their condition. We also advise the patient that treatment is usually lifelong and therapy may be discontinued after a seizure period of at least 2 years, reduced dosage gradually over many months, and sudden discontinuation of drug may precipitate to status epilepticus. Also, complex partial seizures, which require lifelong drugs so as to want to continue living a normal life. What are the pharmacological management? First of all, you start the therapy with one kind of a drug, and usually phenobarbital, and increase at regular intervals until the seizures are controlled or with the side effects not able to appear. So if side effects appear and the seizures are not well controlled, you have to introduce other drugs and taper off the first drug that you use for the patients. So drug used at maximum recommended doses should also be withdrawn if the seizures are not well controlled. Another thing is you can admit if any underlying metabolic cause is suspected, such as raised intracranial pressure, if it's present. You're also supposed to give health education to your patients so that they can be able to take caution because it's a lifelong condition. First of all, you should advise them to avoid being drunk, especially drinking spears over the weekends. They're supposed to eat at regular intervals. Also, stress, physical or mental, may precipitate a fit. So, thus, they're supposed to manage the stress very well. Avoid sleep deprivation. Also, advise them never to swim alone because if an attack gets them in such a condition, they won't be able to save themselves. Also, you should advise them to avoid operating heavy and sharp edged machinery because this might easily cause harm to them or loss of life in case they encounter a seizure. Also, to prevent burns, protective shields should be made around fireplaces and cooking fires such as jikos and everything. I hope we've learned something and we can be able to help our patients who have seizures and give them health education based on their condition and always to adhere to their medication. Thank you very much.